Kids might need. My name is Courtney Adams, and I'll be speaking on HIV on today. My general purpose today is to inform you guys about the different ways that you can contract HIV and the ways to find out how you have it and to prevent it. I do just want to make everyone aware of the severity of HIV and AIDS on today. HIV stands for human immunodeficiency virus. It affects the immune system by destroying white blood cells, known as CD4. Reduction of these cells prevents a person's body from fighting infection. There is currently no cure for this disease. I have a visual aid for you guys just to look and see how the cells are formed, how they look, how they are darkened instead of them just being pure white. You just pass it around. There are currently 35 million people infected with HIV and AIDS. 3.2 million children are living with HIV. HIV is a disease that affects us worldwide in every race and gender. So it doesn't matter what color you are or what female, male, anybody can be affected. I have done my research thoroughly to be able to give you accurate information about HIV. HIV can be spread in multiple ways. It can be contracted by sexual intercourse, anal, oral, or vaginal, by body fluids, which means blood, and pre-seminal fluids, which is also called as pre-cum, semen, and vaginal fluids. Sharing needles and syringes with someone who has HIV can also be contracted by that way. Also, if you're getting a tattoo and you're not making sure that it's clean, it can also be infected by that kind of way also. Also through pregnancy, if you're breastfeeding and you don't know you have it, or if you're giving that child your breast milk, if you have HIV, it also can be contracted in that kind of way also. And when you're giving birth, it can be contracted by the blood while you're giving birth also. There are multiple symptoms that you would have for you to recognize that you have HIV. You may have fever, fatigue, swollen swollen lymph nodes, diarrhea, weight loss, cough, and shortness of breath. Within a month or two of contracting HIV, your body may get symptoms as if you have the flu. After then, it may sort of calm down, and you can go years and years without knowing that you have this disease. And a lot of times when people find out, it's already too late and it's contracted from HIV to AIDS. There are multiple stages of this disease. The first stage is acute infection, which is the first stage. It occurs about 2 or 4 weeks after you come into contact with it, which, as I said, you may have flu-like symptoms, and then after then, it may go away. You also have clinically inactivity, which is also called latency. This virus will become less active. Like, as I say, you go years and years of having the virus without even knowing. Then after that, it turns into AIDS, which is the last stage of the infection. AIDS is characterized by severe damage to the immune system. Whoever, the individual that has it has anywhere between, the picture that I let you guys see, the cells, anywhere between 500 to 1,500 of CD4 cells in each milliliter of the blood. A person with CD4 count below 200 is considered to have a result of HIV positive. There are millions of people infected with HIV across the world, which with most of them not even being aware of the disease. There are about 50,000 people infected with HIV each year, estimated as 1,201,100 people from the ages of 13 and older are living with HIV infection. 168,300 are unaware of this infection. 47,352 people were diagnosed with HIV in the United States in the year of 2012. In the same year, estimated 26,688 were diagnosed with AIDS. As my conclusion, I would like to just express to you guys that HIV is a disease that, as I said, affects the whole world. Do not share needles. If you're going to have sex, which we practice, we should practice celibacy, make sure you use protection to the best of your ability. And also, make sure you follow your yearly and monthly checkups and go to your nearest health department. It was a nice speaking to you guys, and you guys have a nice evening.
Look at here.